Hey everybody, welcome back to the show. Today we're going to talk about something really important, breast cancer. Now I know this might seem like a serious topic, but trust me, it's really important to be informed. Breast cancer is one of the most common cancers affecting women, though it can also occur in men. The good news is that early detection is key, and it can make a world of difference in treatment and outcomes. So today, we're going to go over the early signs and symptoms you should be aware of. We're going to break it all down, make it easy to understand, and hopefully help some of you out there. So stay tuned and let's get informed together. All right, let's start with the basics. We're talking about your breasts. And yes, guys, you have them too. It's so important to get to know your own body, and that means doing regular self-exams. Don't worry, it's not as scary as it sounds. Think of it like this. You know how your favorite comfy sweater feels, right? You notice right away if there's a snag or a loose button. Well, your breasts are kind of like that. You want to be familiar with how they normally look and feel. So, what are you looking for? Well, any changes in size or shape are definitely something to pay attention to. And keep an eye out for any lumps or thickening of the breast tissue. It doesn't necessarily mean it's cancer, but it's always good to get it checked out. Also, look for any dimpling of the skin, kind of like that orange peel texture, and redness, irritation, or any changes to your nipple, like it becoming inverted or having discharge. Those are all things you want to tell your doctor about. Remember, early detection is key, and knowing your body is the first step. So, don't be shy, get up close and personal with yourself. It could save your life. Now let's talk about what you're feeling. We all experience those random aches and pains, right? But when it comes to your breasts, it's important to listen to your body and pay attention to any persistent discomfort. Now, I'm not talking about the occasional soreness before your period. That's totally normal. But if you're experiencing pain that just doesn't seem to go away, especially in a specific area of your breast, it's worth getting it checked out. And it's not just about pain either. Maybe you're noticing some swelling that wasn't there before, or your skin feels itchy or unusually warm to the touch. These can all be signs that something's not quite right. Again, it's not always a cause for alarm, but it's always better to be safe than sorry. So if you're experiencing any persistent or unusual sensations in your breasts, don't hesitate to talk to your doctor. Okay, now let's talk about something called lymph nodes. They're these tiny bean-shaped glands that are part of your immune system, and they're all over your body. You know those little bumps you feel under your jaw when you're sick? Those are lymph nodes. Well, you also have lymph nodes under your arms and near your collarbone, and they play a big role in keeping your breast area healthy. Sometimes these lymph nodes can become swollen, and that can be a sign that something's going on. Now, swelling in your lymph nodes doesn't automatically mean breast cancer. It could be caused by something as simple as a common cold. But if you notice any lumps or swelling in your underarm or collarbone area, especially if it doesn't go away after a while, it's definitely something you want to bring to your doctor's attention. Think of it this way. Your lymph nodes are like little detectives, and sometimes they pick up on clues that something might be off. So it's always a good idea to listen to what they're trying to tell you. We've talked about changes in your breasts, pain, and even swollen lymph nodes. But sometimes the signs of breast cancer can be a little more subtle, kind of like those hidden messages in movies. You know, you're watching a movie, and there's this seemingly insignificant detail in the background, but then it turns out to be a major plot point. Well, sometimes our bodies send us subtle signals too, and we need to pay attention. For example, have you been feeling really tired lately, like a level of exhaustion that just doesn't seem normal? Or maybe you've been losing weight without even trying and you're not exactly complaining, but it's just kind of strange. These things could be signs of many different things, but they can also be associated with breast cancer. So if you're experiencing any unexplained fatigue, weight loss, or just a general feeling that something's not right, don't brush it off. It's always better to be safe than sorry, and talking to your doctor can help put your mind at ease or catch something early on. Well, we've covered a lot today, but the most important takeaway is this. Early detection is key when it comes to breast cancer. The earlier it's caught, the better the chances of successful treatment and recovery. So, be your own advocate, get to know your body, pay attention to any changes, and don't be afraid to ask questions. If you notice any of the signs or symptoms we talked about, don't wait, schedule an appointment with your doctor. Remember, knowledge is power, and taking care of yourself is the best thing you can do. Thanks for joining me today, and remember to be kind to yourself and each other.